The situation in South Africa, as you know, the numbers have been increasing, and the government are obviously looking at every possible measure to increase the intensity of the response there in support of their communities. And as part of that due diligence and reaching out for support and assistance and advice, the Minister of Health and his Director General, as well as other staff in the Ministry, have been reaching out to our regional office in Africa, to our Regional Director, Chidi Moeti, but also directly to the Director General. And our most recent conference call was a three-level conference call in which we were discussing the challenges that South Africa has faced, particularly the operational and technical challenges of scaling up the response at community level, scaling up surveillance, providing extra support to laboratory diagnostics, amongst other things. WHO is working with South Africa to provide surge capacity in very specific technical areas, and we are also providing virtual support, in fact a virtual mission as well to support that. So a number of key individuals at global and at regional level will be both providing physical on-site support to the response as well as virtual support in the coming days. South Africa has a tremendous internal capacity in public health. It has done a good job in responding to what has been an escalating situation, and it is only wise and smart that a responsible government will reach out for whatever assistance it feels that it needs to add to the quality and intensity of its response. And on the mission, yes. Well, I'm not quite sure if they're there yet, but our small team is hopefully on its way to Beijing, or will be very, very soon. We've been engaged in a series of virtual consultations, again with scientific and other colleagues at the National Health Commission, at the China CDC, in looking at work already done on the preliminary or earlier investigations and scientific studies on the origin of the virus. We continue to look at the opportunities for scientific collaboration and in terms of reference for an international mission, and we're already beginning to reach out to experts at the international level to see who will be available and most appropriate to be able to support an international mission in the coming weeks. Again, as I said previously, the logistics of that are not straightforward, I can assure you, but we are pleased that we now see the level of engagement that I think is important and will drive a successful mission. These are important questions. The answers are even more important, and I think everybody in the Chinese scientific community and the international scientific community is anxious to move forward with the appropriate studies to fully understand the animal origins of this virus. Yeah.
Thank you. Dr. Tedros, did you want to say anything more about South Africa or no?
You want me to say more? Okay. Sophie. No, thank you, Sophie. I think Mike had covered it very well. We had a very productive meeting with His Excellency Minister Zweli, Minister Zweli, my brother. We have been interacting all along. This is, a regular contact, and we have agreed to boost our cooperation. And as Mike said, all levels participated from our country office, regional and headquarters. And we will increase the frequency of our engagement. And based on some of the requests that South Africa has already done. So we will intensify our cooperation, and I hope to make progress in controlling the pandemic. Thank you.
Thank you, Dr. Tedros. The next question comes from Morocco, from Monsieur, and I apologize if I get your name wrong, El Bouktawi, from MAP Morocco. Please unmute yourself and ask your question. Mr. El Bektawi, can you hear us from Morocco? It sounds like we've lost him. So we'll go on. We have a question from Spain, from Isabel, from EFE, from the Spanish Newswire. Isabel, could you unmute yourself and go ahead with your question?
Do you hear me?
Very well. Please proceed.
Hello?
Hello, Isabel, we can hear you.
I don't hear anything, sorry. I don't know if you are hearing.
We are hearing you. Can you hear us? It sounds like we've got some technical problems. We'll send Isabel a message to tell her she can ask her question a little later. We have Imogen Fuchs, BBC. Let's hope we do better with you. Imogen, can you unmute yourself and ask your question?
Hi, Margaret. Yeah, I hope that I'm the exception to the rule and you can hear me.
Well done.
I just wonder, I know you have been very quiet on this, but we had these quite surprising comments from US Secretary of State Mike Pompeo in London on Tuesday. Do you have any response to that, or could you give us an idea of how you think a big organisation like the WHO can respond to that kind of comment?
Yeah, thank you. I think we haven't kept quiet. Actually, we released a statement. And as you know, the comments were done, I think, on last Tuesday. And the comments are untrue and unacceptable, and without any foundation for that matter. And our sole focus and the focus of the entire organization is on saving lives. If there is one thing that really matters to us, and which should matter to the entire international community, it's saving lives. And WHO will not be distracted by these comments, and we don't want the international community also to be distracted. As you know, one of the greatest threats we face continues to be the politicization of the pandemic. COVID-19 does not respect borders, ideologies, or political parties. And I have said it many times, COVID politics should be quarantined. And I'm appealing again to all nations to work together. Politics and partisanship have made things worse. So what is very important is science, solutions, and solidarity. But I repeat, the allegations are untrue and without any foundation. Thank you.
If I might add, I feel the need to say something as an American, as a proud WHO employee. I have had the honor and privilege to sit next to Dr. Tedros and Dr. Mike Ryan for I don't know how many days since the beginning of this pandemic, and I have never been more proud to be WHO. I've worked for this organization, with this organization, for more than 10 years. We have dedicated staff in all of our regions and in countries working all over the world. We have partners that continue to work with us and engage with us, and I am particularly grateful for those that continue to show their support for us. But I see firsthand every day the work that Dr. Tedros does, that Mike does, that our teams do all over the world. We are firmly focused on saving lives, as Dr. Tedros has said, firmly focused. We will not be distracted. And that is what we remain, and we will continue to remain focused on.
and just on that, many of us have worked 7 days a week, 20 hours a day for the last 7 months. Everything we think, everything we do is focused on trying to save lives. And we send, and have sent for years, our people into harm's way every day. Many of us have spent months and years on the front line, risking our lives and worrying our families for decades in this fight for social justice. It's really important that we try and maintain the morale of all frontline workers, be they WHO, the rest of the UN. I can say, too, that none of us are perfect, but we all serve. We serve to save lives. And we're here in the service of the vulnerable people of the world. And again, I am proud to sit by the side of Dr. Tedros in doing that, because our organisation and his leadership are intertwined. And we have benefited from that leadership, from that direction, from a transformation in our organisation. And I can say this as someone who's spent a quarter of a century associated with this organisation, transformation that I thought might never come for an organisation that truly needed to change the way it did business. I've seen that happen. We are committed to that. We are proud to be WHO, and we will remain so, and we will serve the vulnerable people of the world regardless of what is said about us.
Thank you so much, DG, Dr. Van Kerkhoff, and Dr. Ryan. I'm not meant to say anything, but proud to be WHO now more than ever. The next question goes to Chen Waiwa from China Daily. Chen, could you unmute yourself and please go ahead?
Hi, Dr. Tedros, you just mentioned in the opening remarks that half of the cases came from 3 countries. We all know that's US, Brazil, India. So my question is, has WHO focused special resources on these 3 countries to put them on the right trajectory? Because, you know, as Dr. Ryan mentioned about the coercive measure, I sort of find it confusing, because like some US congressmen rejecting wearing masks, they say that I have a facial autonomy. So that sounds ridiculous to me, but I don't know. Is this coercive if I ask you to wear a mask? Thank you.
I think the 3 countries you mentioned are powerful, able, democratic countries who have tremendous internal capacities to deal with this disease. And there are many, hundreds of thousands of brave frontline workers, doctors, nurses, hygienists, logisticians and others who fight in the front lines, just like in every other country. You know, it is a given. Large countries can have large problems because by their very nature they are large, they are populous, they are complex. And also there are differences of opinion and differences between the federal and the state level in many countries all over the world. It's one of the prices that countries pay for democracy in that context. So we are always ready and will always remain ready to provide advice, input and service to any of our member states, wherever they are, and constantly offer advice and support to them. But particularly these 3 countries and many more, have tremendous internal capacities and I believe can turn this around because of the nature of their public health, their science and their innate capacities to fight this disease. And I trust that these 3 countries are doing that and will do that and will escalate and upgrade their responses in order to bring this disease under control. Maria?
And just to add on the legal topic, one of the reasons that we've set up this new law lab is to help countries to better understand how they can legislate for the response. As Dr. Ryan said, it's a matter of balance between making sure that people voluntarily work with us to make sure that we save lives, but in cases where legislation is necessary, We're trying to provide countries with good advice about what good legislation looks like that will help those countries to deal with things like the compulsory wearing of masks in appropriate circumstances and to deal with quarantine in appropriate circumstances. And that's where the legal lab comes in, to help countries to better understand what other countries are doing and to share information about how they can make appropriate laws which follow WHO guidelines and help save lives.
If I could just briefly add to say that, to supplement what Mike has said, that, we stand ready to support all countries everywhere. I think many people, certainly in my friends and family, perhaps thought we were here really to support maybe lower income countries or lower resourced countries, but we are here to help all countries. And we work through our regional offices and we work through our country offices to provide support to everyone, everywhere. And I think just a message to say that even in those 3 countries that have the highest numbers of cases right now can be turned around. It can be turned around. And there are tools that all countries have that can do that. It takes tremendous will, it takes tremendous leadership and the work of all people to be part of the solution and to play their role. And what Dr. Tedros was speaking about today in his speech, and what you've heard us say many times, is everyone has a role to play. And so when you are thinking about the steps that you need to take to prevent yourself from getting infected, you're not only protecting yourself, you're protecting others that live around you, that you live with, that you socialize with. So continue to practice physical distancing, continue to clean your hands, continue to adhere to the recommendations that are put in place for your safety. Continue to know where that virus is and learn everything you can about this virus, because as we do every day, we're learning something every day. And some of our guidance may be adapted. Some of the guidance and recommendations in your area may be adapted based on that current situation. So keep yourself well informed about how you can protect yourself, your family, and your community.
Margaret, I just may add too that WHO's regional office for the Southeast Asia is based in Delhi under the leadership of Dr. Poonam Singh, who herself is Indian, and one of our largest country offices in the world is actually in India and works very closely with the Indian government. Similarly, one of our strongest offices in the Americas is in Brazil, and we work with both the federal and state level and have worked together very successfully on the management of dengue, yellow fever and other diseases. So those countries are intertwined with us. Obviously, the United States is not in need of our assistance most of the time, but certainly the US, and I've said this before, the US government is deeply, and its institutions, particularly its scientific institutions, are deeply entwined with global health and providing strong scientific and public health input to so many global health agendas over the last 10 or 20 years. So these countries are not only important in the COVID response, but each of them has a tremendous contribution to make at the global level. And it is a time when we do need global leadership, and large countries in regions very often set a standard for others. They set an example, and other countries follow. And people look to India, people look to Brazil, people look to the United States for leadership, for examples, for ways of doing business. And they tend, when those are successful, to copy those strategies. So these countries are not only important in their own right, they're very important as regional and global beacons of doing the right thing.
Thank you for those comprehensive. So we now will go to Priti Patniak from here in Geneva, Geneva Health Files. Priti, please unmute yourself and ask your question.
Hi, can you hear me?
Please, yes, very
Hello?
well.
Yes. Yes, my question is basically, I wanted to find out whether WHO is concerned about the lukewarm response it has received for the COVID-19 tech pool. Is there an update that you can share? We see that not as many countries have signed up as one hoped. And is it possible to share some details on what kind of technology you expect to be shared and so on? Thanks for taking my question.
The Costa Rican initiative, yes, yes.
We would have to get back to you on the details. Your question is well asked, but I don't have the specific details on the number of countries and the technologies that are currently on the CTAP platform. So what I propose we do is we get that information, we send it through Margaret to you, and maybe bring, on Monday we will also maybe give a couple of minutes to give an update on CTAP, if that's okay with you.
Excellent question, and just send it to me, harrism@who.int, and we'll make sure you get a good answer. The next question is for Isabel. We're going to try. Isabel has reconnected. Isabel from FE. So Isabel, please unmute yourself and ask your question.
Yes. Do you hear me?
Very well. Please ask your question.
Yes, thank you very much for trying again. Thank you. My question is, as you know, there are several outbreaks in Spain, and most of them, even if they are restricted to a few geographical zones, this is happening after you warned that we should have been very careful after the confinement. And I would like to hear from you, what is the lesson we have to learn in Spain and in other countries? In this context, a quite important proportion of these contaminations happen in nightclubs, as you mentioned. Do you think that it's most reasonable to close these sites until the situation is under control?
I think I think we have to be careful here that when we see clusters of cases or a rise in cases after lockdowns are lifted, that in some way that is projected as an error or a fault or a failing. It happens. The minute you raise the pressure on the virus and the virus is at community level, you will see sporadic or clusters of cases. The question you should ask is, what is the reaction to that? What we've seen is in areas that have lifted restrictions very early without having control on the virus have seen a very fast jump back up. But in other countries, even in countries that have brought the disease under extreme control, like Germany and Spain and others, where the numbers have been suppressed to very low levels, that when you open up, there's always a chance that the disease can be imported or the disease can spread from unseen clusters. And the real, I suppose, test of community and government is how quickly can you get those under control? How quickly can you detect the cluster? How quickly can you test the people in that cluster? How quickly can you get the results from that? How quickly can you identify the contacts? How quickly can you identify the risk factors? Was the risk factor a nightclub? Was the risk factor a mass gathering? What do you need to do at the community level to prevent that happening again? Do you need to implement some local movement restrictions? What we're really trying to get here is move from, as I've said before, using a very big hammer to trying to be more precise in what we're doing. Instead of restricting everyone, we try and go after the virus and we try and identify where the virus is and then specifically and surgically, in a sense, excise the virus from the community by minimizing the impact on the lives and livelihoods of the community by focusing in on cases, on contacts and investigation. So countries coming out of lockdown, even countries with low levels of disease, will experience potential cases and clusters of disease. And I believe in this case, Spain, like many other countries, have reacted quickly, they've reacted well, and are on the incidence of disease is stable, and yet we still have to deal with a few of these clusters that have emerged in a number of countries. So I think, and that is really how we get to what the DG spoke about. We have to learn to live with this virus. We will not be able to eliminate or eradicate this virus in the foreseeable future. And we have to learn to find a way to get back to our lives, to get back to some kind of normality, to do that with, as Dave has spoken about, with respect to human rights, with respect to the use of law, with using every single tool that we have as a society to suppress this virus in a sustainable way, to make maximum disruption to the virus and minimum disruption to ourselves. Now, how do we go about doing that? And we need everybody on board. The DG's spoken. It's not just the authorities on board. It's not just the responsibility of the authorities. It's also of communities and people within those communities. And more the youth, and not just the older ones, the old fogies like myself and others. Youth culture can break this. Youth culture can help drive this pandemic, or youth activism can help break the back on this virus. And going to the issue then of closing sites, everything about gathering is related to the background incidence of the disease in the community. If there is no disease in the community, then it's safe to re-engage in normal activities. If disease is in the community, and if you have intense community transmission, then any activity that brings people together in crowds, especially indoors, will lead to further transmission of the disease. Because if you don't know where the virus is, but you do know the virus is spread in your community, and you bring people together in large groups, you're going to get transmission. And in that sense, governments are going to have to make decisions based on the local epidemiology as to whether things like bars and clubs, in particular circumstances, need to be closed or have restricted numbers, or whatever it is they need to do to reduce the chance of person-to-person transmission. Maria?
Thanks. I really appreciate the question, because I think so many people are dealing specifically with this question. Of what are the lessons that can be learned, once you've been successful at suppressing transmission, what about these sporadic cases and clusters that are starting to appear? I think the lesson is that we should expect this. We should be ready for this to happen. And with all of the systems that are in place now, which countries have worked so hard to put in place, they need to be used fast. They need to be used aggressively and robustly and with no regrets, with the exception of ensuring that when these interventions are put back in place again, where you may shut down something temporarily, it's done for a temporary amount of time, and it's done in the lowest or smallest geographic region as possible. I think everyone wants to avoid these huge so-called lockdown measures again. We do too. We hope that we don't need to see these again. But if these outbreaks are dealt with swiftly, if the test, treat, contact trace, care for, if all of that is put in place and done really quickly, you have an opportunity to really put that fire out quickly. And we are seeing countries do that. I think it's important to know where, as Mike has said, where these outbreaks are occurring. Is it in a particular entertainment sector? Is it in a long-term living facility? Is it in another closed settings? And if you, as an individual, have an opportunity to avoid going to a nightclub, maybe it's worth avoiding that nightclub for a little while. I don't think we've talked so much about nightclubs in recent days and recent weeks, because these tend to be the hot spots right now. But I think having a blanket of closing all nightclubs is not the solution either. I think we need to have a data-driven approach. Where is the virus? Where are the opportunities for the virus to transmit? If it happens to be in a certain area, then yes, perhaps maybe they need to be closed for a little while. But again, you have a choice yourself to make and say, do I do this? Do I go to this? I said the other day, there's a lot of things that people want to be doing. I do too. We all do here. But there's not necessarily things we need to do. The things we need to do to keep our families safe and alive, and we need to perhaps make some sacrifices ourselves, so that essential workers and frontline workers who are putting themselves at risk every day to keep businesses going, to serve us food, for healthcare workers who are out there who are caring for patients, they need to go to work, and they choose to go to work proudly. And we are very grateful for that. So again, we all have a role to play, and we really do need to make decisions based on risk to keep ourselves safe and keep our families safe.
Thank you very much, Dr. Van Kerkhove. The next question, we are going to try to go back to Morocco, and I believe that Monsieur El Baktoui has reconnected. So, Monsieur El Baktoui, please unmute yourself and ask your question. Looks like we're out of luck today. We have come up to the 6 o'clock. We've come up to the end of the hour, so I'll close this press conference, but of course I will hand it over to the Director General for final words.
Thank you, Margaret. Thank you to all who have joined us today, and see you on Monday in our next presser. So thank you again.